So how does depression affect fertility? How does depression affect being able to get pregnant? Well, again, it's huge. We talked earlier on about stress and how stress affects what's going on in the different sort of parts of the brain, which then will affect what's going on in the body, which then will affect what's going on in our reproductive organs. And over time, once we've been trying really hard to get where we're going and to get pregnant and that doesn't happen, then, as I said, all of these emotions come up. Why me? What's so wrong with me? We look at everybody else. Everyone else seems to do it so easy. Why can't I? Again, all these inner questions, and we start to berate ourselves. We start to get really, really hard on ourselves. We almost start to attack ourselves. And this is when the next stages can happen, and you can start becoming quite depressed. Depression is anger turned inwards. We give ourselves such a hard time. And I know, my goodness me, I seriously did, in my journey. So depression, like stress, has a huge effect. It's connecting on all those different hormone levels and stopping, because the body thinks, again, we're in fight or flight. It thinks that we're in danger. So it just shuts everything down, and it's not going to go any further. And so it thinks that our body can't do it. It's not going to go and do that. So we also get a lower libido. Again, that's the one thing we've got to do. We've got to have a fantastic libido to get pregnant. And yet depression hits, and that's the one thing that goes. We just can't face it. We just don't want anybody. We don't want anyone near us. We start to sort of get isolation. We start pushing people away. And then with that, we get low self-esteem. We start feeling, that we're just not worthy. Again, it's just so sad what depression can do to us when we're so desperate to get and have this outcome. And it's a vicious cycle. It's a massive vicious cycle that, again, affects the one thing we want. And then if we go to the doctors and say, I'm feeling depressed because I can't get pregnant, and the doctors might, not always, in all cases, give us antidepressants. And antidepressants have a massive effect on our fertility. So again, huge vicious cycle. So our best thing then is to start figuring out, okay, what is the one thing that I can start doing to help get myself out of this depression? And so I work a lot. I've done a lot of different fertility courses to deal with hypnotherapy. Actually, I'll reword that. I've done a lot of hypnotherapy courses to deal with fertility, and hypnotherapy is just beautiful, and it's just wonderful to help with depression and help people just sort of get out of that sort of little hole that we've ended up building for ourselves, so we can feel that we can get out and poke our head up and know it's okay. I'm not the only one, and this is quite a normal thing that can happen on our road to fertility. And that it's okay, So, the best thing we can do is to acknowledge it, to accept it, go get some help, and however right for you that is, don't go and get some, because then you can move forward and then start changing that whole block so it can be unblocked, allowing the body to be that wonderful, fertile thing that it can be, and get you where you want to go. So yes, definitely for depression, something to be aware of and to work with so that you can work out of it.